Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Kellen Mori. Born in Brazil, Dr. Mori is a member of the American Dental Association and has over 30 years of experience. She practices in the heart of Beverly Hills and focuses on compassionate dental care. Today we're going to be discussing mouth guards. Now, Dr. Mori, today we're talking about mouth guards. Can you tell me exactly what a mouth guard is?
So a mouth guard is a dental device that covers your teeth and gums and protects from injury. It could be from a fall, it could be from sports injury, or even, if you grind a lot, you would need a mouth guard. I like to say it's like a crash helmet for your teeth and jaw.
Is a mouth guard the same as a retainer, or are those two different things?
They are two different things.
Okay.
A retainer is thinner. It's something you wear at night also, but just to keep your teeth in the same position so you don't have a relapse from an orthodontic movement.
Okay, got it.
A night guard is much thicker, and they usually cover one arch.
Okay. Now, how would someone know that they need a mouth guard?
The most common reasons are, your partner complains that you're clenching your teeth at night and you make noises when you sleep, so grinding. The dentist can tell you because they're visual wear facets on your enamel. You can see your canine, they used to have a point, now it's flat. And also, if you wake up with jaw pain or headaches.
Yeah. Now, why do people grind their teeth at night? I know that's something I've experienced that myself, and I know maybe it's stress, but are there specific things about your smile or your bite maybe that cause that?
The most common, it's stress.
Okay.
Everybody has a stress in their life. Even kids grind their teeth at night. I have 3 daughters and they all wear a night guard. If they don't, the noise is just, you can see how even stressful, they played at school and somebody didn't, play with them.
Yeah.
And adults, we take a lot of our stress in our mouth. The mouth really takes a lot of stress.
Now, what would some of the risks be if you're grinding your teeth at night and you're not wearing a mouth guard?
Well, the problem would be you're going to grind so much that your bite's going to collapse. You're going to lose your vertical dimension, and everything starts kind of, out of alignment. Teeth have to be so aligned, so every cusp and falls. So if you grind out so much your back teeth, they start collapsing, and you're going to start chipping your teeth. You're going to break. So that's one of the main reason.
And this is something, as you mentioned before, that you might not notice, but any dentist, if you're going and getting regular checkups, would be able to tell you're grinding.
Oh, absolutely.
Okay.
Absolutely.
And what is the difference between a snore guard and a night guard?
So a snore guard, it's different in a way that they position your jaw forward, so your airway is a little more open. Usually goes on both arches, and it has a range. So they move your jaw forward so you have more air coming in.
How would someone know they need a snore guard? I think I'm probably guessing that someone in their lives has told them that they're snoring.
Yeah, that's the main concern. Usually they come and say, my husband tells me that I snore. I should sleep in the room next door. But also, you wake up tired. If you're not sleeping well because you're snoring or, you don't have enough air, you can have more stress, and you wake up tired.
Is there actually negative effects from snoring, or is it more negative on the people around you?
Yeah, the snoring is more negative than the people around you.
Okay, that's what I would figure. And what exactly causes sleep apnea?
So sleep apnea, it's caused when your muscles of your throat are relaxed and there's not enough air going in. Usually they say causes by, it's more common in male, obese, and over 40 years old. So it's when there's too much relaxation of the trachea muscles and the air is obstructed.
Thank you so much, Dr. Mori. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on mouth guards. So if someone needed a mouth guard or a snore guard, what is the process in getting fitted for this?
The best way is to go to your dentist and get a scan, a digital scan taken, because it's much more precise. You know, these mouth guards that you buy at a pharmacy,
Yeah.
they're, they're just molded, doesn't fit well, so it's not going to be comfortable, you're not going to wear it. So we recommend that you come to the dentist, we do a digital scan, and they're made in the lab specifically that fits really well in your mouth, and it's going to be comfortable.
And how long would a mouth guard generally last?
They usually last between 6 months to 24 months. It depends on your wear. It depends how much you grind. It depends on the factor of do you wear every night, but usually between 6 and 24 months.
How would a patient know when to replace them? Is it something that you take with you to the dentist or just by looking at it?
I tell my patient to always bring their guard. First, I want to see if they're wearing, because I can see wear facets, I can see grinding patterns in their guard. Also to clean it well, you come to the dentist, I can put in a special solution so it'd be better, because you don't want to wear something that is a little crummy, right, in your mouth.
Yeah. And is it expensive to get a mouth guard? Or is this like a very costly procedure for someone to do?
It is expensive. A guard can be anywhere from $500 to $1,000.
And is there specific insurances or financing options that would cover this?
Insurance doesn't really cover a night guard.
Yeah.
So the best way is to use CareCredit, and we offer in our office.
That's wonderful, because I'm sure the CareCredit credit card is something that people could use, because if they're not wearing this mouth guard, as you said, it could lead to just, grinding down your teeth or having to have really expensive procedures done in the future.
Yes. If you don't wear a guard, you can crack your tooth, you can crack a molar, and if you break your tooth, the only way is extraction.
Yeah.
So an extraction, you're going to need an implant placed, so it can be very costly.
Thank you so much for that helpful information, Dr. Mori. Now, I know you practice compassionate dental care, but is there a specific moment that stood out to you?
Well, I don't treat kids, but the other day I brought my daughter to the office because one of her baby molars wasn't coming out so easily.
Okay.
And, she was scared, but she let me treat her. And then at the end, she was like, I can see why patients come to see you, Mama, because you really make me at ease.
Oh,
you're very
that's
gentle.
So wonderful. Yeah.
So
that must be so heartwarming hearing that from your own child, too.
Yes. That made my day.
Well, thank you so much, Dr. Mori. It was so informative, and thank you so much for sharing all your knowledge on mouth guards.
Thank you.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.